The hidden risks of accessibility. 3 of the 5 medications I'm about to discuss require no prescription. You can enter any pharmacy today and purchase them directly off the shelf. Paradoxically, this accessibility is exactly what makes them so hazardous for individuals over 70. When a product is easy to obtain, we often stop treating it like a potent drug and begin viewing it as harmless. For a person who has crossed the age of 70, that misconception can represent the difference between maintaining independence and requiring a hospital bed. There is a critical reality that many physicians fail to explain adequately during a brief 15-minute consultation. The human body processes medication in a fundamentally different manner after age 70. Your kidneys filter substances from your bloodstream more slowly, and your liver metabolizes compounds at a fraction of the efficiency it possessed 20 years ago. Furthermore, the brain becomes significantly more sensitive to sedatives and anticholinergic chemicals. The Beers criteria and benzodiazepines. Today, I am highlighting 5 specific medications that illustrate this clinical problem. All 5 are included in the American Geriatric Society's Beers criteria, a peer-reviewed, regularly updated registry of drugs considered potentially inappropriate for older adults. This is not fringe science. It is mainstream geriatric medicine finally reaching the public. I'm Dr. Thomas, and this channel is dedicated to translating current research into practical, actionable information for adults over 60. The first category is benzodiazepines. You likely recognize brand names like Xanax, Valium, Ativan, or Klonopin. While prescribed for anxiety and insomnia, their short-term effectiveness is precisely why they remain so problematic. After 70, the brain's sensitivity to these drugs changes. Because the liver processes them slowly, they accumulate in the system. A dose taken at 10 p.m. for sleep may still impair your balance when you get up at 3 a.m. for a glass of water. Fall risks and the danger of sudden cessation. Falls are currently the leading cause of fatal injury for Americans over 65. We are not discussing a minor side effect here. Beyond physical injury, benzodiazepines consistently impair attention, memory, and executive function, even in those who feel they have adapted to the drug. The American Geriatric Society explicitly advises that older adults avoid this entire class of medication. However, if you are currently taking Xanax, Ativan, or Valium, do not stop abruptly. Sudden discontinuation can trigger severe withdrawal symptoms, including seizures. This requires a professional consultation with your physician to establish a supervised, gradual taper. In a few moments, I will explain exactly what to bring to that appointment. Please comment below. Are you or a family member currently using any of the medications I've mentioned? The hidden danger of over-the-counter sleep aids. The second medication often shocks people because it is an inexpensive over-the-counter staple. Diphenhydramine. Sold as Benadryl for allergies, it is also the primary sedative in Zizquil, Unisom, and PM versions of pain relievers. Millions of seniors use this nightly, assuming that over-the-counter availability equates to safety. After age 70, it does not. Diphenhydramine is a potent anticholinergic, meaning it blocks acetylcholine, the neurotransmitter essential for learning and memory. A landmark 2015 study in JAMA Internal Medicine followed over 3,400 adults aged 65 plus for 7 years. Researchers identified a clear link between cumulative anticholinergic use and dementia. Those with the highest usage faced a 54% increased risk of developing dementia compared to non-users. A case study and the risks of NSAIDs. Consider the case of Eleanor, age 71, who used diphenhydramine nightly for 5 years for sleep. Her family observed a steady decline in her memory and increased confusion. When a geriatrician finally removed the drug from her regimen, her cognitive scores stabilized and partially improved over 7 months. Her daughter described the recovery as getting a piece of her mother back. The third category involves medications many seniors reach for at the first sign of joint pain. NSAIDs, such as ibuprofen, Advil, Motrin, and naproxen, Aleve. While manageable for younger adults, the risk profile changes entirely after 70. Because kidney function typically declines by 40% to 50% by this age, these drugs linger in the body longer, potentially causing acute kidney injury. The 2023 Beers criteria update specifically reinforced the need for dose adjustments based on renal function, gastrointestinal, and cardiac complications. The risks of NSAIDs extend to the digestive system. The stomach lining thins with age, and these medications further impair its protective barrier. According to the NIH, older adults using NSAIDs regularly are 3 to 5 times more likely to experience serious gastrointestinal bleeding. For those with hypertension or heart disease, these drugs also increase fluid retention and blood pressure, elevating the risk of heart failure. This trifecta of kidney, stomach, and heart risks makes daily NSAID use a dangerous habit after 70. Let me know in the comments if you currently rely on ibuprofen or naproxen for pain. I will shortly discuss safer alternatives for joint management. Next is the fourth medication, prescribed to roughly 10 million Americans annually, zolpidem, Ambien. The Ambien trap and nutrient depletion. The FDA has issued safety warnings regarding zolpidem and the elderly, noting that blood concentrations can remain dangerously high the morning after ingestion. Many seniors feel awake but remain pharmacologically sedated, compromising their reaction times. Research links zolpidem use to nearly double the risk of hip fractures. Given that hip fractures in those over 70 carry a 20% to 30% mortality rate within 1 year, this is a grave concern. The fifth medication is perhaps the most surprising: proton pump inhibitors, PPIs, like omeprazole, Prilosec, or Nexium. While effective for short-term reflux, 4 to 8 weeks, many seniors remain on them for decades. Long-term use quietly depletes vitamin B12 and magnesium. A study in JAMA found PPI users had a 65% higher risk of B12 deficiency, which can cause peripheral neuropathy, numbness, and cognitive issues mimicking dementia. Action steps for medication safety. If you are concerned, follow these steps. 1. List everything. Document every prescription and over-the-counter pill you take. 2. Request a review. Ask your doctor for a geriatric medication review using the Beers criteria, BEERS. 3. Explore alternatives. Discuss acetaminophen as a first-line alternative for pain, ensuring you stay under 3,000 mg daily for adults over 65. For sleep, ask about CBTI, cognitive behavioral therapy for insomnia. 4. Consult before changing. Never stop a prescription medication without medical guidance, especially benzodiazepines. Your body has changed since you may have started these prescriptions. Your medication list should reflect your current needs. Comment, "Reviewing my list," if you plan to audit your medications today. Next week, I will cover dangerous supplement combinations that are quietly risky for seniors. I'm Dr. Thomas.